Good morning. Today we'll be talking about asthma, and the theme for this World's Asthma Day is making inhaled medication accessible for all. So, our question here today is: are inhaled medications available and accessible to all in Nigeria? We'll be talking to two specialists. Good morning, Dr. Ayanda and Dr. Odeyemi. It's a pleasure to have both of you here on the program.
Good morning.
Good morning.
If I could, thank you. If I can just kick off with Dr. Ayanda. Dr. Ayanda, can we just to sort of go over what asthma is again for those who are who are listening? Can you tell us briefly what is asthma and why is asthma an important topic? Why should there be a World Health Day for it?
Okay, so hello everyone. So asthma, first of all, it's simple terms. It's a chronic inflammatory airway disease, which manifests by recurrent symptoms. Usually those symptoms could be chest tightness, wheezing, cough, or shortness of breath. And these symptoms occur as a result of some obstruction to the passage of air from the nose into the lungs. And what causes this obstruction is the inflammation. So simply put, asthma is a chronic inflammatory airway disease. Why asthma is so important is because amongst all the chronic diseases that affect the lungs or the respiratory system, asthma is the commonest. It affects people of all ages. In terms of numbers, from latest statistics, it affects more than about 270 million people globally. So which is why it's very important. And coming back home, various studies, there's an average incidence of about 10% of the Nigerian population with asthma. So it's an important condition and it affects a lot of people. So that's why there's a day set aside for it.
Thank you. So, Dr. Odeyemi, now people say there's an epidemic or that there's a huge or rising incidence of asthma globally. Is that true? And is that also true specifically here in Nigeria?
Well, thank you very much. Yes, I must say that indeed that is actually true. And it is also true specifically for Nigeria. And why is it so? The obvious reason is because of the westernized lifestyle we have all decided to adopt now, okay, as against what it used to be in the past. What do I mean by this? In the past, I mean, our grandparents, they walk barefooted. I mean, they walk to the farm long distance. Okay, they are usually involved in a lot of physical activities, and they eat natural foods, not processed food like we enjoy to do these days. Most of us these days, we don't exercise, and then we also love to eat processed meals. All of those things is what I refer to as what westernized lifestyle. These has actually, I mean, led to increase in the incidence of these non-communicable diseases such as hypertension, diabetes, and of course, asthma. So the fact that we are adopting this westernized lifestyle also here in Nigeria has also contributed to increasing the incidence here in Nigeria. So indeed, it is true.
Now that is something that is very worrying. They do say also that it is increasing a lot among children. Why?
Yes. Now, first of all, I would like to say that the exact cause of asthma is actually unknown. Okay, but we know that certain things predispose one to it. Now, and for the most common type of asthma, it actually starts during childhood. Okay, and why is this so? Well, again, like I said earlier on, the exact cause really is actually unknown, but it may have to do with some hormonal imbalances, okay? But the summary is that yes, it's actually common during childhood, but it doesn't just end at childhood. It actually progresses throughout life, but it is indeed a fact that is actually common amongst children.
Thank you. Dr. Ayanda, going into asthma now, people, we've heard the terminology a lot. How does it manifest? What are the symptoms? What are the signs? How does a person know they have asthma?
Okay, so we usually talk about four cardinal symptoms of asthma. So these symptoms include cough, shortness of breath, chest tightness, and then wheezing. Wheezing is a form of noisy breathing that sounds musical. It may sound like whistling. However, these symptoms, all the four doesn't have to occur together, but the important thing is there's some variability, meaning that there are days when the person experiences these symptoms and the person may be able to tell you, oh, it's when I inhale dust, or it's when I'm exposed to cold, or when I'm stressed. So the individual will be able to tell you that these symptoms sometimes happen. Sometimes it tends to be worse at night or early in the morning, or when they're exposed to some specific triggers. Most times, even if they don't do anything, they would actually get better and then they will continue with their activities. It's just that it may become more frequent and then it can become so severe that they don't get better until they present in an emergency room. But usually, these symptoms happen recurrently with varying severity, and usually in most people, it's following some specific exposures. So that is how people with asthma usually present.
And now, we've talked a bit about the different kinds of ways they present, but how does it sort of manifest sort of in our own environment? How do people take it? Do people take asthma when it comes as a spiritual attack? Do people recognize it for what it is? Is it, you work in the cosmopolitan city of Lagos, so is it easily recognized so people know what it is and come in? Or do you still have issues where people don't recognize it properly and you're having difficulty in for people coming in for that diagnosis?
Well, I would say that most people actually do recognize it. Sometimes it's because one of the major risk factors for asthma is a history of allergy. So sometimes there may be some other family members that may manifest. So usually it's more about accepting the diagnosis because somehow, especially in Lagos, a lot of people have an idea of what asthma is, but sometimes they really don't want to accept that diagnosis, or they are hoping that,
Why?
well, partly because of the nature of treatments, and also because, like in an adult, we tend to say it's chronic, it's lifelong. So they nobody wants to have a chronic condition. So it's some challenges about getting them to accept the diagnosis. But usually, um, people are able to recognize these symptoms and they complain. And most times, the term asthma comes up during the review or the consultation.
So they know it's asthma, but it's almost like it's not my
So
portion. Is that the kind of thing you're talking about?
Yes.
Wow. So now we're talking about making inhaled medications for all. So talk about asthma, talk about the symptoms. What are the kind of treatments, and why is it that inhaled medications are so important in an asthmatic?
okay, so what happens in an asthma attack is that because of some exposures, the person's body, that's those air passages, there's some production of some chemicals um, that we call cytokines, which the body is producing as a reaction. So that's the inflammation. So this inflammation in the airways leads to those airways getting swollen, closing up. So it becomes difficult to breathe. So now the treatment for asthma involves treatment targeting this inflammation, addressing the inflammation, and also opening up those closed airways. So the treatment traditionally is divided into relievers and controllers. Traditionally, because right now we kind of have some hybrid medications that can do both. So, but why does it have to be inhaled? Now, inhaled medications deliver the drug directly into the air passages where we want it to work. So it's able to rapidly treat the inflammation and the the bronchoconstriction, that's the airway closing up, and at the same time with minimal side effects, because the doses in the inhalers are so small. They are mostly in micrograms because it's going straight to where it's supposed to work. Because of that, very, very little enters the bloodstream and goes somewhere else. So there's less risk of side effects from inhaled medications, and it's effective, it's potent, it's efficient, and it works when used properly. So that is why the mainstay of asthma treatment is inhaled medications.
And that isn't, or to be accessible to all? To all.
Yes, to all.
Yes.
Thank you. Thank you very much. So, Odeyemi, how available is are inhaled medications in Nigeria now? You're from Osun State. Is it available there? Is it something that people can get around the country?
Yeah, I must say that the inhalers are actually quite available. I mean, my patients don't find it difficult to get the inhalers once I prescribe. They actually get it. So I must, and also I'm aware, even outside of Osun State, because I speak with colleagues from some other states all over the country. They actually let me know that these inhalers are actually quite available.
But the issues with what? With cost?
Yes, now the issue is with cost, and this particularly has to do with the fact that, healthcare in Nigeria is largely out of pocket treatment. I mean, out of pocket payment. And you see, and this honestly is really, really not helpful at all. The ideal thing should be that, I mean, there should be health insurance for all, and all of these medications made available under health insurance package for all our patients. That way it becomes, I mean, readily affordable. But unfortunately, we all know what it is with our health insurance in Nigeria. So I think really that is the only thing, the fact that people need to pay out of pocket, because for a number of patients, cost is actually the issue, not really availability as such. So government
Okay.
really needs to do a lot more in ensuring that, I mean, people, there's actually health for all, by ensuring that people have appropriate insurance, and this drug should be made available under the health insurance scheme.
Well, I know that there are certain things being done now with the National Health Insurance Agency. I'm hoping that this can address some of the issues we're talking about. So, Dr. Ayanda, if I can go over to you, but there's more than just the issue of availability here in Nigeria, isn't there? There's also the issue of acceptance. How
Yeah.
acceptable are inhaled medications to our own population?
Okay, so generally, in terms of when we compare inhaled medications to maybe tablets or injections, inhaled medications are less acceptable in our own environments due to various factors. Usually, giving something inhaled, in most people's experiences, either maybe from watching movies or having relatives, maybe they were very ill and they gave oxygen, usually it leaves a mark of the person is very ill and the person maybe died. So they have this fear that, so if you mean that my treatment is going to be inhaled, does it mean that one day there's a problem, I'm not able to have my inhaler, I will just die? So they have that fear and they are worried, and they would rather that the treatment be more conventional, like tablets or even an injection. So there's that fear, one. Then secondly, using inhaled things is usually associated with, psychoactive substances that young people take to get high. So sometimes some patients feel like, if my treatment is an inhaler, to other people, other colleagues, it looks like I'm using something that they may misterm it and think that I'm using a drug. Or at the same time, they start using words like addiction with their treatments. So most times, there's some challenges with acceptability of inhaled medicines. And it's one of the key things that has to be discussed when discussing with a patient with asthma. If you do not really try to counsel and make them understand why the choice is inhaled, then there's a tendency that they are not going to want to use it. So that acceptability, and relating it to cost, acceptability, or when it comes to market, it drives availability. If they stock medicines and put it on the shelf and people are not buying it, they are no longer going to stock it. So if the asthma patients come and they say, no, give me tablet salbutamol, give me tablet prednisolone instead of the inhaler, the pharmacists too are going to be stocking less, because it's going to tie down their capital on the shelf. So we have to really do more work to make it acceptable to the patients, and then it will become more accessible.
Well, this is what we're doing here now. And I think it's more than just talking to the patients. It's also talking to the public, which is what you're doing here on this program. It's telling people about this medication to make sure people are free to use it. Dr. Odeyemi, so this stigma that is around the inhaled steroids here in our country, how can we break it?
Well, one very important way we can break it is by what we're doing here right now, public enlightenment, okay? And which is why I must say I actually appreciate this program for. We need to take programs to schools, okay, to churches, just to make people, churches and mosques, so that people will really know that, there's really nothing much to using inhalers. For me, it's all about public enlightenment, okay? Reaching out to people and making them realize that the fact that you're using an inhaler doesn't mean, oh, you're about to die, okay? I'm just like Dr. Ayanda said, really, if patients are in the hospital, the moment they are told, oh, you want to get oxygen, so there's this fear, oh, am I going to die soon? And the way to actually solve the problem is by engaging people, is by talking to people, talking continuously, and programs such as yours will actually go a long way really in reaching out to people to, to help them to realize that, there should be no cause for alarm if you have to use an inhaler.
There's also that, and I think we need to address it so that we can talk about it really and open it up. There's also an issue with the fact that people hear, oh, a person didn't have asthma for a long time, then they couldn't get their inhaler. They didn't get their inhaler and then they died. So there are those stories out there, but people don't realize that, some of those things are related to people imagining they are no longer asthmatic. So how do we, can you sort of break that down and explain how people think they sometimes are healed and then they go think they're not asthmatic anymore, and what the implications are, so that we can sort of separate the two and make it clear?
Yeah, so at the start of the program, when Dr. Ayanda was talking about this asthma, one very important thing I think she talked about it is the fact that the manifestations of asthma, the symptoms of asthma, is not always there. It comes and goes. Okay, so these symptoms can actually resolve with treatment or even without treatment. But I must emphasize that there are times that even when the symptoms are not obvious, it doesn't mean that the underlying problem in asthma is not there. That's the inflammation she actually spoke about happening in the airway. So, but people may not have symptoms for quite some time. And the moment people don't have symptoms, oh, they tell themselves they are healed of it, okay? Then the other problem also is the fact that, Nigerians are actually quite religious, okay? You hear people give testimonies in church, in mosque. Oh, doctor said, I have asthma, but for some time now, I've not had any symptom. My asthma is gone. And really, it is not like that. Yes, so asthma can be quiet even when it is there. Period when it is quiet, and then people may tend to believe, oh, the asthma is cured. At that point, people usually do away with their inhalers. The inhalers are not actually nearby. And when the symptoms come suddenly, okay, the patient can actually just die because they've not been using the inhaler for some time, and really they've kept it away. We've heard of situations whereby somebody believed, oh, my asthma was during childhood, I'm now cured of asthma, and then she was actually about to travel on her, she got to the airport, all of a sudden the symptoms came and inhaler was nowhere to be found. and this patient actually died. So really, I mean, the thing is that we should believe. Yes, and that's why it is important to emphasize when we are telling people about asthma, the fact is the symptoms are not always there. They vary over time and in intensity. Okay, so this fact needs to be what's emphasized for people to know. The fact that the symptoms are not there at a particular time does not mean you are cured of the asthma, does not mean you should do away with the inhaler. In fact, the lowest level of treatment for asthma states that a patient must have the inhaler around and use it when necessary. Okay, so but it doesn't say, oh, do away with the inhaler, you are cured of the asthma. So as long as people have that belief that yes, even though I'm symptom free at the moment, it doesn't mean I'm cured. The inhaler needs to be nearby. That way, people are actually good. So that's a very important way of actually addressing this problem.
Dr. Ayanda, unfortunately, you won't believe this, but our time is already up. Dr. Ayanda, do you have any last words for our listeners?
Okay, so important thing is for everybody to know that asthma is common, it's treatable, and the mainstay of treatment is inhaled medications. So every individual, even if you don't have asthma, I mean, you should know that. And if you interact with somebody that's a colleague or somebody around you that has asthma, support them, encourage them to, to be able to use their inhaled medications freely without feeling ashamed or feeling somehow. So everybody should support people with asthma and encourage them to use their inhaled medications as prescribed.
Thank you very much. Dr. Odeyemi, your last words?
Well, my last word will be that people should realize that asthma is actually treatable. Okay, just as she has said, people should not be shy about having their inhalers, I mean, in their pockets and going about with it. And they should actually ensure that they use it as prescribed. Inhaler techniques, very important. It's one thing to have the inhaler, is another thing to know how to use it appropriately. They must ensure that they're using it as prescribed by their doctors. Thank you very much.
Thank you. Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.